Dr. Maria Akani, thanks for joining me today. I have to introduce you officially, though. I'm so used to just calling you Maria, but that's fine.
Yeah.
So thanks for joining me on this talk about stigma and depression. So as we get into it, maybe I should start with letting you introduce yourself so that people watching this know who you are and your background.
Okay. So my name is Maria Akani. I am a psychiatrist and I'm also a clinical neuropsychologist. I also have some background in a certificate course I did in Christian counseling before I got into medicine or clinical neuropsychology. Yes.
Okay, great. How long
I'm
have
also
you been?
managing
Sorry.
consultant of Renaissance. It's a company that deals with counseling, coaching, psychotherapy, psychiatry, and training.
So you've been practicing, in psychiatry for quite a number of years now. And so you've dealt with people, obviously, with depression quite a lot. And there's a lot to talk about as far as depression goes. But today I'd just like to focus on the issue of stigma and depression. So what can you tell us about that?
Well, it's a real thing. I can tell you that in Zambia. And part of it is because in Zambia, there's a lot of association to things that we can't understand in terms of spiritual aspects. So if people can't see it, if it doesn't show up on a thermometer, if it doesn't show up in a microscope, then it's considered something that is superstitious, and people are very suspicious about it. So either they go to the one extreme of making it very spiritual and it's related to Christianity and demons, or the other spiritual aspect, which is traditional, and people will think about it in terms of witchcraft and so on. So I guess that's where the background really comes from when it comes to stigma in Zambia. And people have not yet come to embrace the fact that depression is also an illness like malaria and other physical illnesses that we have. Yes.
Okay, great. So I mean, you've talked about people not understanding because it's so intangible and they can't see it physically. So what have been the most common manifestations of depression that you've seen in your setting, in your practice?
So different, actually. I've seen extremes where people are hearing voices, seeing visions, have gotten to a point of self-neglect where they're now peeing on themselves, they're not talking, they are completely mute and really need to be supported through that. And then I've also seen others who can't quite put a finger on something, but they know they're not well. So I've seen others who came and said, I'm not even sure I should be here. I'm not even sure why I'm here because I don't really have anything wrong, or I don't really have any problems, so to speak. My marriage is good, my work is fine, my health is good, but I don't feel all right. There's something missing. And when we sit down and then go through what sort of symptoms they're having, we discover that they are having a type of depression.
Okay. Well, that's an interesting point about, people thinking, well, if everything is okay in my life, then I cannot have depression. It takes something to be wrong in my life. But actually, even if everything is okay in your life, you can still be depressed because, as you're saying, it's a mental illness, and therefore sometimes it can attack you even when you don't have anything particularly bothering you. There's just these imbalances in your brain in terms of neurochemicals and so on.
Absolutely.
Yeah. So in terms of dealing with such people, how easy is it for them to accept then that they have depression when they think, well, everything is okay, I'm not sure I'm supposed to be here?
Well, I think it's always a problem when we're dealing with mental illness, and indeed any illness, if the person themselves doesn't want to get help. I've seen people who have had physical conditions. I once had a male patient who came in with gangrene on his thumb after having a human bite, and we told him we needed to amputate it, and he ran away from the hospital, came back with now the whole arm gangrenous, and we had to amputate the whole arm. So if a person is refusing care, there's only so much that you can do. Of course, there are cases when a person is really out of their elements and they're harming themselves, or they're harming other people, or they actually don't realize and require a certain level of stability before they can see that things are wrong.
Yeah.
But in essence, when a person doesn't want to get help, it's very difficult to get them to get help. We've had parents who brought their children. I need you to counsel my son. I need you to counsel my daughter. They have a problem. And we sat in there and the person just refused to talk because they don't want to be there and they don't want to get help. So there's still an element of the person needing to get help. When we are dealing with physical illnesses.
I lost you.
Okay, I was saying that when a person comes to the hospital by themselves, they say they have a headache, they have a tummy upset, then you're able to help them because they themselves have reported that they need this help and you can do the intervention. The tricky part, though, about mental illness, especially in Zambia, is that the awareness is so little that sometimes people may just not know, when do you get help? Is it okay to go for help when you're feeling like this? Do I have a big enough problem for an intervention? And is there even an intervention for something like this? So is the only thing hospitalization and pills? Is there anything in between? So those are some of the challenges we have.
Yes, I guess the knowledge about the condition itself and where to get help and what kind of help can be really a big challenge. But as far as stigma and such issues go, how free are people to talk about depression generally, either those who might have it or society in general?
Well, I think people are not very free. And part of it is there's a sense in which people look at things like depression as a sign of weakness. And if you're depressed, then it means you're failing in some way to cope, or you have an altered perspective of life. So you find that when people are struggling, they would rather just withdraw and be in themselves. And also, sometimes people tend to belittle other people's problems. So when a person is in a situation where they feel like this is really a crisis for me, and someone else looks at it and thinks this is nothing, then they start to feel like they're not validated and that they would rather withdraw and not get the support because they're being judged. And most times people think that if they tell you of worse people, then you will feel better. So they'll try and tell you, oh, but you know, you're not so bad. There's so-and-so went through this and so-and-so went through that. Yeah. But that sometimes makes the person feel like you're therefore not saying my problem is anything worth attention.
Yeah, exactly. I think that's very common. And sometimes it's not that people necessarily want to make you feel bad. They feel like they're helping, maybe from a point of view of not understanding. And so they feel if they tell you worse things about their own lives or other people's lives, they say, oh, but your life is much better. You know, why aren't you happy? Why are you depressed? And so you're right that often comes out as lack of validation of someone's problems, to saying, oh, you have no problems, you know, you have no issues. So why aren't you okay? Have you noticed any differences in terms of how men and women deal with it, though?
Well, I think men hide more. Yes, and in Zambia, the differences we usually see is that men will self-medicate quite a bit with alcohol and drugs. And women also will self-medicate, but I think women in Zambia tend to be more expressive about feeling low. So you find more women are willing to go and get help, talk to someone, and unfortunately, more women would then end up going to the profita or the papa or something, so that maybe it can be prayed away and exorcised away or something. So I think those are the key things that are seen in terms of behavioral patterns. In terms of actual actions, I guess I'm not able to give a proper pattern. Maybe one of the things we see is that women will cry a lot of the times and express themselves that way, and men will be more quiet and withdrawn from their communities. Yeah.
Okay. Yes, I think that's pretty common that, society generally regards that if you're a man, you should be strong, don't show emotions, you should be an example to everybody despite, how you feel. So I think that is a big problem because it leads a lot of people maybe to feel guilty about feeling a certain way when society expects this masculine sort of masculine type of person, and that you shouldn't show such emotions. So perhaps men out there need more help than women, because I think women have more of an outlet for their emotions, and like you're saying, talk about it more.
Yes, but also I think generally in the world over, there is a sense in which people feel that depression is a sign of weakness. So
True.
even in societies where when a person does not have altered perspective, where you have hallucinations and delusions and so on, even if people may not deal with that, the issue around it is that people think that depression is a sign of weakness. It's a sign that a person is negative, that they've given in, that they're not ready to fight anymore. So a lot of the times you find that that's why people think that a treatment for depression is to try and encourage the person and give them all this motivation.
Yeah. So what is the reality then? If it's not a sign of weakness, then what would you say depression is? What would you tell somebody that thinks it's a sign of weakness? What would you tell them to get rid of that perception?
Well, the truth is there are various factors that can lead a person to depression. So some of them have to do with infections. So infections that can affect the brain and the brain structure, and therefore the neurotransmitters in the brain. Some of them it's post-traumatic. So either an accident, an industrial accident, a fall, and post-traumatic also includes things like stroke, because then they've affected the integrity of the brain structure and so on. Alcohol and drugs. And alcohol is a big problem because alcohol is a depressant, and there is a false perspective in which people think that when you drink alcohol, it actually makes you feel better. But it just makes you absent from the situation, and then it continues to be a depressant and worsens the depression. And for people who may not have even who may not have even been depressed before, alcohol and drugs in themselves can cause depression. Then we also have things like tumors that can affect how a person then, the structure of the brain, and therefore result in depression. And when we're talking about that, we're talking about organic causes.
Yeah.
But there are other causes that are environmental or external, so to speak, the circumstances. If a person has experienced, say, a bereavement, if I am a twin, I've lost my twin.
Yeah.
And that is a loss that affects me emotionally. So it's requiring all my resource, my emotional resource, my financial resource, my intellectual abilities, my mental abilities to get over that. And within a space of another month, I lose my mother. And this is someone I'm also close to and relying on the support, because you find that if a person's support structure is hammered, their internal resources depleted, that can lead to depression. And that's why work can lead to depression as well. When a person is stressed and they put in their best in this project, and while their resources are still low, something else hammers at them and they put in their best in another project, and it goes on, their resources are depleted, they can end up decompensating and end up with depression. Because what helps a person to be in a sound mental state is not just their physical health, it's also their social support and their mental abilities to deal with that. But if there's a strain on all those things, a person can be depressed as well, despite the fact that they may not have any organic injury to the brain.
Okay. Well, that's very good to clarify to people who might think it's a sign of weakness. I mean, from my experience dealing with depression and with other people, you find that actually it's the opposite. It's what you said, that sometimes it's the strongest people that end up depressed because they try for so long to handle things on their own and handle all these issues that are going on in their lives, as you said, without a support structure. They don't talk to anybody about it. So eventually your mental resources, your mental energy gets depleted, and you end up in such a situation with depression and so on. So that's been also my experience with that it's people who try to be strong for too long on their own that can end up in such a situation as well. So it's important to seek help early, I suppose. You mentioned one important thing, and maybe we haven't covered this, but what about children? So we talked about men, women. What about children as far as depression goes, in terms of the issue of trauma, for instance, that you mentioned, or any other factors around children? Is it the same, or do you see it different in children?
So when you say, do we see it differently in children, do you mean the causes? Do we see depression the same in children? What do you mean?
In terms of partly the causes, but also in terms of how people handle depression in a child, as far as stigma goes. How do people handle depression in a child?
So unfortunately, it's pretty much the same, that we find that a lot of times when children are depressed, and I've had a problem with that, because I would be telling a parent that your child is depressed, and they would be saying things like, first of all, those are textbook illnesses, they're not found here, and so on. And other examples are, oh, if parents, these children are just spoiled. When we were growing up, our parents would just discipline us. And so sometimes the issue is, let's put in more disciplinary action. Let's get the child to do more things. They're just being lazy. They're just being silly. And so the approach is more to discipline them. Sometimes take them for prayers. Take them for all kinds of prayers, whether it's anointing with holy water or the temple priest or whatever, but trying to really make sure that maybe we can pray away these negative spirits that are affecting our child.
Exactly. So again, there's also a reluctance to accept that the child is going through depression and so on, even in those settings. I guess the difficulty with that is,
and there's also a shame, because I've seen that a number of people seem to want to hide it, and so they don't talk about it, and they try to conceal, and even feel anxious when you try to refer to this. So some of that has resulted in a lot of delayed diagnosis, because they don't want to be seen to take their child for this. And obviously delayed diagnosis means delayed interventions. And what that does for me, why that breaks my heart, is because for a child, they're defining themselves. For an adult, they would have already defined themselves. So having depression doesn't necessarily come into the identity of who they are. They may say it was an incident that happened in my life. But for a child, they end up defining themselves by that experience. And having a very dragged out diagnosis means that for a long time the child sees themselves like that, and it affects their self-esteem. And we have so much more work trying to undo that and help the person see past their mental illness.
Okay. Well, that's an important factor that you're mentioning, that these are formative years for the child. So if they define themselves by that, and because of not seeking help early, then that's quite unfortunate. I've seen cases where parents or guardians will hide such children and just, keep them at home. They don't want them going out in public or to be seen, because of that shame that you talk about, that they don't want that on themselves. But I think it's important that they seek that help early. So how can one best support somebody with depression in light of stigma? Maybe before we get to that, how does it affect medication is my point, because these are drugs you have to take every day and so on. So with stigma in the picture, how does that affect people's ability to comply with medication needs and so on?
Well, it affects them a lot. First of all, just the idea that a person has to take medication. So we spend a lot of time convincing clients that you need this medication. I wouldn't be prescribing it if I didn't think you needed the medication. But also, they can't wait to stop taking it. So unlike malaria, which you take medication for 3 days, and UTI, maybe you take for 7 days, psychiatric medications are taken usually for not less than 6 months. And so already that's something that a person has to commit to, and their mental state has to be ready to be able to do that consistently. And so you find that when a person has issues with stigma, they think, oh, okay, well, then I've only got it for, I think I'm sure by next week I'll be fine. And the moment they start to feel fine, they want to pack the medication and they end up having relapses and so on. So yes, it does affect stigma quite a bit. I mean, it does affect medication quite a bit. And also because, like you said, if the person has to take it every day, then if they're in a company of people and they have to visit at someone's house, they might decide, let me just skip for these 5 days that I'm at this person's place because I don't want them to see that I'm taking this medication and so on. And there is this belief that the longer you take medication, the more reliant you will become on it. So people tend to want to stop taking medication as soon as they see symptoms subsiding. But the truth is, if you stop taking medication too early, even though symptoms are not there, the neurotransmitter balance we're trying to achieve would not have been achieved. And so the chance of relapse is actually higher.
It's higher, of course. So the other aspect, you're saying if somebody takes it longer, doesn't mean they have to be on it forever, right? They can still get off it no matter how long they've taken it.
Yes, that's true. And so those are things we review depending on a person's situation. There are different kinds of situations. Others may have to take it for a shorter time. But even if you have to take medication for a lifetime, for me, what I always talk about is how everyone is showing up with something. We don't know what it is that it takes for someone to show up to be their best. Some of them have got an iron rod in their thigh. Others have got a stent in their heart. Others are taking medication, insulin jabs every day. Whatever it is that you need to do in order to show up to be your best, that's what's important. And if it means taking medication, do it. Because trying to take away that is really shortchanging yourself. The race is about putting in your best performance. And you're shortchanging yourself by not doing that.
Okay, I think that those are very encouraging words. Is you do what you need to do to be your best self. You know, if it means you take medication for that period, take it so that you are the best person that you can possibly be. I think that's very encouraging. And I can see men especially being reluctant to take medication because, of course, there's that initial fear to even admit you are depressed. So going the extra step of now taking medication every day at home and so on might be a big challenge, especially for men. But I hope they will hear this message that you've given. I think it's a good message. Do it so that you can be your best person, you know, in all circumstances. So let's talk about, as we wind up now, I know you've got a busy schedule. You told me you have patients to see in the next 10 minutes or so I don't want to keep you. How can somebody best support someone who is depressed in terms of avoiding stigmatizing or making them feel bad about their situation?
Well, the first thing is that the person has to validate them. So if a person is feeling sad, acknowledge that they feel sad and acknowledge what their problems are. They may not be your problems, but just be able to acknowledge what the problems are. Offer a listening ear. And one of the things that we do in Zambia, we like to give advice. And a number of times we call people who are giving advice as counselors. And I often say what we call counseling in Zambia is a lot of advice giving. That's
rather than listening.
Yes, that's not what you need sometimes. You just need someone to help you walk through that. And it's amazing how having someone to listen to you, as you listen to yourself, you actually organize your thoughts and clarify yourself much better. And you start evaluating yourself, what your beliefs are, and you can actually get out of the situation better. But also being the person that can then say, look, if you need support, I can walk with you to that place. I can help you find a person who can help you through this. You can talk to me if you're having anxieties about this. There's nothing wrong with getting help. So being the person that can even suggest to this person who's depressed that they need professional help if they need professional help, and being there for them to help them to get out of the house. Sometimes that's just one of the things a person needs, to get out of the house and show up for the day.
Okay, I think that's very helpful. So the bottom line is just to be there to listen and to support the person without being judgmental and without necessarily, you know, saying offering solutions. If sometimes just a helping hand, a listening ear that matters. So thank you very much, Dr. Akani. Any last words as we close?
Well, just to say that first of all, I'm really glad you're doing this program. And one of the things I said earlier was how I think that sometimes people don't know when they need help. Yeah. And my encouragement is that if you're not sure if you need help, just get it. The worst thing that can happen is that you can find that you don't need it. Otherwise, just get out there and get the help.
Great. Thank you. I think that's a good message to close on. Thank you for your time. I really appreciate it.